Let's get started.
Welcome to Fox News. Today we'll be reporting on the MonWHO Health Organization that was held today in Montreal. And the first story that we're going to talk about is Merck, the pharmaceutical company. Today in the Asian regional bloc, Afghanistan presented a resolution concerning mental health. They discussed their partnership with Merck to have antidepressant drugs distributed in Afghanistan and in their promotion of mental health awareness. During the press conference, I asked a question to Merck concerning the cultural sensitivities of bringing a drug that is used predominantly in Western countries into Afghanistan. What research have you done to ensure that the actual antidepressants will work with the population in Afghanistan?
Well, these antidepressant drugs that we're talking about have already been trialed and tested in many markets, notably North American markets. The population of Afghanistan does not differ substantially from that in Europe or North America to the point where it would affect the biokinetics and the pharmacokinetics of the actual product. So I think that particular question is irrelevant to the case of this drug.
Actually, their response was quite borderline racist in the sense that they compared Europe and Afghanistan to be the same. They said that we've done trials in Europe and in America, and humans are the same all over the world, so therefore there shouldn't be any differences in Europe and Afghanistan. But Merck, there is a difference in the sense that you yourself mentioned in the press conference that there's a taboo regarding mental health and all over the world, and in particularly in Afghanistan. So we asked, how are you going to break down this taboo without any cultural sensitivity in Afghanistan? We had an interview with Merck and asked them these questions.
I'm making a statement that the biological action of the drug will be similar across the world. If you take a pill of Advil in America, it has the exact same effect as taking Advil medication in China or in Papua New Guinea or in Russia for that matter. It's more of a statement that the socioeconomic statuses are different, and I think it is Fox's agenda to conjure up false allegations against Merck. Merck believes that...
Or you don't know who you work for, is that it? You just forgot?
I think that Fox News should take a basic biology course before attempting allegations on behalf of differing populations and confronting a pharmaceutical representative who's representing a company that has done the research and has conducted trials to establish that the mechanism of action for its drugs is equivalent irrespective of population and irrespective of culture.
Okay, well if you have done that,
populations, and we respect the differences in culture. We are purely providing essential medicine to better their health. This interview is over. Thank you.
But Merck, you need to understand that your drugs need to have a pre-trial for every demographic that you're going to be using them. We were able to have an interview with the United Kingdom delegate, and he also expressed the seriousness of having cultural sensitivity trials for Afghanistan.
For antidepressants, they are overprescribed in much of the industrialized country. So there's definitely a need for some kind of framework or even reform in the way we see the mental illnesses.
So that shows that there is a seriousness to have further trials and further specific strategy for Afghanistan. As well, after this interview, we were very lucky to have an interview with the Afghanistan delegate, where she was very surprised at Merck's statement. She said that Europe and Afghanistan are the same thing, the people are the same, therefore the results are the same. As a representative from Afghanistan, what's your position on this?
So actually, I am a bit surprised that Merck did say that, because the people in Afghanistan, I'd say, yes, we are humans as a whole, the society does work together, but it's not the same in relation to what they've been going through, especially the civil war state that Afghanistan has experienced for the past decades. Since, I believe, the early 1900s, it's been a civil war state with domestic violence, abuse, sexual assaults, especially with the Taliban too, that was going on. So I mean, It's hard to say, and I'm surprised that he would say that the situations are the same. I mean, yes, the medication might help, towards the same purpose, but definitely not to alleviate the same problems.
So we have to ask ourselves some questions. Mark, what drugs will you be giving the Afghanistan people? Are you going to give them a low markdown of the ones that you use in England, or are you just going to give them the same drug and not have any programs in place to ensure that these people are having drugs that are catered to what they're used to? You're going to take someone that doesn't use a Tylenol to use an antidepressant drug? We need to do better. And I guess that they can't answer these questions because they're too busy in their scandal regarding taking profits and buying a villa in Mumbai. This is Foxy from Foxy News. Stay Fox.
Fox 10 News.